Cancer is a disease characterized by uncontrolled growth and spread of abnormal cells in the body. Normally, cells grow, divide, and die in an orderly way, but in cancer, this process is disrupted. Instead of dying, the cancer cells continue to grow and divide, forming a mass of tissue called a tumor. Tumor can be benign, that is non-cancerous, or it could be malignant. Malignant means it is cancerous. At this stage, you have to take your health very serious. Welcome to the program Health 247. I am your host Irene Okechukwu, and today we are going to be discussing on cancer, the myth and the misconception of cancer. And as usual, I will not be alone. I'll be having medical professionals who will take us through on what cancer is about. They will be telling us the myths and the misconception people have about cancer. But before we go, if you want to be part of this show as usual, you can follow us on all our social media handle on official Rapid TV, or you could just sit back and keep watching us on Rapid TV channel 176 on Star Time. But before we go, we are going to be sharing the experience of cancer survivors and get the message that they have for those who are battling the disease and how they can deal with misconception of cancer. Don't think cancer is a death sentence. It is not. But if it's early detected, you could be safe. So sit back and relax as you watch the experience of the cancer survivors. Stay tuned. Alright viewers, welcome back. As I earlier stated that we have some nurses who are also an oncologist. We call them oncology nurses. They are here to tell us the myth and misconception of what cancer is. So most of you people, when you hear the word cancer, oh, the doctor has diagnosed you of cancer, you're already a living dead. You feel like your own is finished. So they are here to debunk it. They are here to give you hope. They're here to educate you more on what you need to know about cancer, so that when you detect it at an early stage, you can get yourself treated and be saved. So I have with me today Mrs. Magdalene Eroin and also Mrs. Emilia Abba. You're welcome to the program on Health 247.
Thank you very much.
Thank you so much.
It's a pleasure. So I want you, that's Nurse Emilia Abba, you have to tell us what cancer is about and what are the misconceptions of cancer.
Cancer is a disease condition in which there is abnormal growth of cells that divides and proliferates rapidly, uncontrollably. Mark the word, uncontrollably, and invade the tissues of the body.
Wow.
So, I can quickly go into causes of cancer. Actually, the cause of cancer is said to be idiopathic. Idiopathic means it's not known. There is no definite known cause.
Okay.
But there are some predisposing factors that will make one to be prone or vulnerable to developing cancer, such as hereditary. We have certain chemicals. We will deliberate more on those predisposing factors, but let me just mention them. We have like physical factors like radiation. We have even X-ray. We have lifestyle, like some diets that are not being controlled. We also have tobacco and smoking.
Okay, that's if people smoke.
Exactly. All these are predisposing factors. Even obesity, there are so many. So all these can predispose one to developing cancer. And how does it develop? How does cancer develop? One thing we should know is that whenever there is mutation means changes in the gene, cancer develops. There is a process called oncogenesis, carcinogenesis. That is the process in which cancer cells are formed. They have stages of that process. Whenever a person is being exposed to these predisposing factors, as I mentioned earlier, either it is chemical, it is hereditary, it is this and that, you find out that there will be a change in that gene called mutation. And when that mutation occurs, you find out that cancer cells will begin to proliferate, grow uncontrollably, as I said.
Wow.
And because of this, as we will say later, there are some things that one need to do to avoid these predisposing factors. For example, immunity. In our body, we have what is called checkpoints. In those checkpoints, if the immunity is very strong, you find out that the person can be exposed to these predisposing factors, but carcinogenesis will not take place.
Wow.
Formation of cancer will not take place because the immune system is very strong.
Wow.
And they will obey what is called apoptosis. Apoptosis simply means programming cell death. Whenever the cancer cells reaches a point in which that checkpoint, there are two checkpoints, checkpoint 1 and checkpoint 2, called G1 and G2. So whenever they reach that checkpoint, they will obey these death signals called apoptosis and they will die.
Wow.
So they will not proliferate or move to the next stage. But if the immunity is not strong, they will not obey the death signal, which is apoptosis. So because they don't obey the signal, they will move to the next phase.
Wow.
And because of that, they will begin to proliferate. They will divide uncontrollably, causing cancer.
Interesting. Wow. So over to you, Nurse Magdalene. Can you tell us the common myths that people have about cancer?
Okay. Thank you very much. There are a lot of myths and misconceptions that people generally out there has concerning cancer. One of them is, people target that cancer is a death sentence.
Yeah.
Before I went into this oncology training as an oncology nurse, I myself, I see that, anytime they mention anything cancer, the person is already dead.
That is a living corpse.
Yes, yes. But with education and exposure, I get to find out that cancer is not a death sentence.
Yeah.
Though it might seem fatal in the sense that at the presentation stage that the patient presents, the patient might not present at the earlier stage, might not present at maybe stage 1, stage 2. You see, they tend to present at the advanced stage, which is stage 3 or stage 4. But, with the modern technology and medical equipment, advancement in medicine now, we tend to find out that cancer is not a death sentence. There are a lot of things we need to put together to make sure that there is a cure and there is preventive measure. So I'm advocating to the public right now that cancer is not a death sentence. Don't feel that, because I have cancer, I'm already dead. There is hope for you. Exactly. You have to fight it. You are a survivor. Exactly. Another thing also is that some people tend to believe that cancer is hereditary. Yes. In as much as my colleague just mentioned that some of the predisposing factor, which one of them can be genetics, it cuts across genes. But it does not necessarily mean that because your father or your mother as an individual, died from, let's say, the woman in person died of breast cancer, or the man died of prostate cancer, then the offspring also
we have it.
We have it. It's not necessarily like that. You understand? Yeah. There are other predisposing factors, like she mentioned. Aside hereditary, aside genetics, you understand? If you predispose yourself to alcohol consumption, you predispose yourself to tobacco smokes, you expose yourself to cancer of the lungs, you expose yourself to cancer of the livers. We have different types of cancer in general. So you being that, my father died of cancer, or my mother died of cancer, is not a factor that you also will have cancer.
Interesting.
So it's not, that's a myth and misconception. Then another myth and misconception is that some people tend to believe that, oh, cancer bankrupts, it causes bankrupts. Yes.
Because you spend a lot.
Because you're going to see, yes, you know,
things.
that is why, in as much that the treatment options for cancer is quite expensive, but that does not mean that it's going to cause you bankrupt. Because if we admonishes our patients and family members to try to, immediately they are diagnosed of this cancer, try to register yourself in health insurance funds.
Okay.
We have cancer health funds that an individual with cancer can register. They tend to break down this cost of cancer treatment. Though it's quite expensive, because you buying one chemotherapy drugs now, it costs just one small drug that you see in a bottle like this, costs almost 1 million naira.
It's true.
And you see somebody from the rural area coming out, being diagnosed with stage 3 cancer, where will he or she get 1 million naira? Maybe his father is a farmer or the mother is a petty trader. Where will they get 1 million naira? So we advise them to register with health insurance scheme. We have NHIs, we have different types of HMO that can cut costs for all these cancer treatments.
Yeah.
So cancer does not necessarily mean you can go bankrupt, because by the time you register yourself in all these things, they tend to help. They help. They meet NGOs and the rest. They talk about you to most of all these NGOs that are willing to render help out there. So with that, you can gain help. You can get treatment and be cured and be better. You understand?
Interesting.
Then another myth and misconception that people feel, oh, this thing is cancer that causes. They feel maybe eating sugar, excessive consumption of sugar. Yes. In as much as we have comorbidity of illnesses that can also predispose individual to cancer. Comorbidity like infection can expose someone to cancer. Wow. Imagine someone with hepatitis B virus now. You understand?
Yeah.
An individual that has hepatitis B virus can predispose him or herself to cancer of the liver if not well treated.
Okay.
Consumption of sugar does not make individual to have cancer. But then we talk about eating sugar in moderation, because we all know that the byproduct, the end product of sugar is what will be stored as fat. And once fat is stored and accumulated in our system, it tends to lead to predisposing factor to cancer, which is obesity.
Interesting. All right, viewers, it's been my oncologist nurses. I call them my because they are in my program today. So they are taking us through on what cancer is about, the myth and the misconception of cancer. So we're going to go on a short break, and when we return, we're going to talk further. Stay tuned. Alright, viewers, welcome back. So we are going to be asking, we want to know about if cancer is contagious, because there is a belief that, I don't really know whether it's believed, but people always say that someone who has cancer, a nursing mother who has cancer, cannot breastfeed, because they say if she breastfeeds, the fluid will be transferred. The virus will be transferred to the fluid, whereby it's going to also infect the baby. I don't know how true it is. And again, in developing countries, or let's say in the cities, people always use microwaves to heat up their food. And also, some people are already used to the air condition. The air condition, they use it in their houses, in their cars, in their workplaces. That, like, they don't even like to get the natural air. They prefer staying in an air-conditioned room, office, or car. And now they said with the AC, with the AC that they always use, this can cause cancer to them. So can you please buttress this? Like, I don't know how true it is. It's just a question.
Okay, thank you very much for that question. everything still boils down to the myths and misconception.
Yeah.
Like you just said concerning whether being cancer is being transferred or being infected, is
Yeah.
one of the myths and misconception about cancer. People tend to feel cancer is contagious.
Yeah.
You understand? Cancer is not contagious because it is not an airborne. It is not a bacterial infection. You understand?
Yeah.
Though we have predisposing factors that can lead to cancer. Somebody that has hepatitis B, like I said earlier on, is at risk for having cancer if not treated properly.
Yeah.
Somebody that has human papilloma virus,
Yeah.
you understand? Human papilloma virus for
That's
women,
HPV.
HPV. Somebody that has it is at also risk for contracting cervical cancer
That is if it's not treated or...
if it's not treated.
Oh, really?
Yes, if that virus is not treated. And that is why we also encourage our mothers out there. Let me chip this in. We encourage our mothers out there. As soon as you notice, or our fathers, generally, our parents, as soon as you notice that your child is of the sexually active stage, maybe between the age of 9 to 14 years,
Okay.
you encourage them to go out to be vaccinated. Basically, we encourage our parents to allow their children to be vaccinated. There was a time in Nigeria, you know, they called out that, oh, children between the age of 9 to 14 should come out to be vaccinated for this HPV vaccine. But a lot of mothers withheld their children.
They said that you want
A lot of parents withheld their children. They said the
Nice.
vaccine is going to kill the vaccine. I vaccinated my daughter.
Wow.
She's 12, but as at then, I vaccinated her. So I know the implication of it because you can't be there with them 24/7. These children, they will be in the university.
Yeah.
They will go out there. They will soar around the world.
It's true.
It is the little opportunity you have to know, contribute to their life physically, mentally, and know otherwise that you will do for them as a parent. So I'm admonishing you, mothers, fathers, please, whenever you can, though now the vaccine is quite expensive if you want to get it personally, but whenever you hear that this thing is out, there is an outcry of come out, let's vaccinate. Don't take it for granted. It's for the betterment of your child. Because basically the men are the carriers of this HPV vaccine.
That's true.
If you don't know.
Yeah.
The men are the carriers. And once a man infects a woman, another woman goes and meets another man. Another man meets
that's how they
another
keep
woman.
carrying
So
it.
the thing keeps rolling
Spreading.
around, spreading, and the rest. So we have to be very, very careful.
Yeah.
Now, going back to it, the myths and misconception, if it is contagious, cancer is not contagious. Unlike other bacterial infections like measles, chickenpox that are airborne, monkeypox that is of outbreak recently, when an individual sneezes, you know it's airborne. Before you know, the next person has contracted it and the rest. Cancer is not like that. It only affects the individual that is the carrier of it. So you sitting close to somebody that has cancer does not mean that you yourself you are going to get cancer.
Yeah.
Unlike in those days that an individual that has HIV AIDS, remember, they'll say, don't go close to her, don't share spoon with her or cup with her. You know, the stigma was too much.
Too much, yeah.
Unlike, so cancer is not like that. It is only the individual that is the carrier of this disease, and it cannot infect another person.
It cannot be spread.
It cannot be spread. So it's a myth and misconception.
So what about in the area of air conditioned things?
In the area of microwave, you know, research is still ongoing to ascertain the degree and the length of spread, or how it can be contagious to human being, or how cancer can get to us as humans. Research is still ongoing. But then, you know, anything that has radiation.
Yes.
Microwave has radiation. Air condition has radiation.
Yeah.
Even your lights in your house has radiation.
Even our phones.
Your phones, you see some person tend to put their phones on their chest.
Or
they
even
sleep
breast.
off on their breast. Minute form of radiation and being emitted into the system into the bloodstreams. And we also said it, I think my colleague mentioned it, that radiation is one of the predisposing factor to cancer.
Yes.
Radiation in the sense that eye rays. You see, when we enter into these normal natural suns, suns from 7 to 10 a.m. is quite good enough because you need that vitamin D for the synthesis of your bone and the rest.
Yeah.
But sun as from 1 p.m.
That's harsh.
2 p.m., 3. You know, that's extreme heat. That radiation is quite high. So you tend to limit it. So in essence, you tend to do everything with moderation. If you are holding your phone, try not to keep your phone close to your body. If you are using your microwave, there are some plastic that they've advised us to use when we want to use this microwave. Instead of, there are some rubbers or plastic that they banned that we shouldn't be putting into our microwave when microwaving our food, because these rays are being emitted into our food directly. And some of these plastic are also predisposing factors to attract these rays. So we tend to limit them. You understand? So when you are doing anything, I think even the Bible admonishes us that moderation is the best.
Yeah.
Okay, let me add something.
Yeah, go ahead.
Let me add a little thing to what she has just said. She has mentioned the sun. One may ask, for example, like all those people that are farmers, traders, you know, most times they stand under the sun for a long time. They may ask, how will I do? Does it mean that I will not go outside again whenever there is sun? Is a common concern as far as sun is concerned. So in that case, it is advisable for us to be sun smart. Sun smart means wear protective coverings.
Exactly.
You see some persons will expose themselves.
Their skin.
Exactly. You will even see the sunburns on their skin.
Even on their faces.
On their faces. It is not called for. Because as far as you are concerned, it has been research has been carried out and it has been proven that radiation from the sun causes specifically cancer of the skin, which is called melanoma.
Wow.
Melanoma. So we need to be sun smart. If we must be under the sun, we have to wear like our sun shirt, like a cloth that covers us, like a hat, our caps, and all those things that will protect our skin from developing cancer.
Interesting. I've been thinking so much as people have been talking. I was like, oh God. Now, if I think we should protect our skin, we should avoid using microwave too much. So many things. I'm like, oh God, moderation, yes, is the best. But another thing I want to know is the food we eat and the diet we try to adhere or maintain. Are there some certain food that could cause cancer, or some certain diets that we want to observe that could lead to cancer?
Okay, let me talk on that. Remember, we talk about that the cause of cancer is unknown, idiopathic, but they are predisposing factors. Yes, we talk about food. For example, it is advisable that we go on a balanced diet.
That's true.
And we know what a balanced diet is. A diet that contains, no, it's not even 5, it's not 6, it's 7. The current is raw veggies. Fiber.
Wow.
You know, initially it was 6: carbohydrate, protein, vitamin, minerals, fat and oil, and water. But now the 7th one has been added, which is raw veggies, because it has been found out that this is an antioxidant. It contains fiber that help to fight the cancer cells and even help to build immunity. Okay, so in that case, one may say, okay, this I should take balanced diet. Now fat and oil is inside, and you go and take excess fat. My colleague had just said everything should be in moderation. So if you are if you are used to taking so much fats, you know, all these alcoholic, all this preservative food that contains certain chemicals, was among the things I mentioned as predisposing factors. So those things, there are some persons that if they don't fry their food, they cannot eat. If
it's not tasty.
Exactly. So in fact, if they want to take tea, if they don't put so much sugar, excess of everything is bad. So in that case, instead of doing the person good, it will rather predispose the person to low immunity. We call it immunosuppression. And once the immunity is down, remember, it will not obey apoptosis. And because of that, the cancer cells will pass, and they'll begin to do what? Multiply, invade, proliferate uncontrollably, leading to cancer. So it is advisable that we try as much as we can to eat a balanced diet and make sure that this balanced diet, we include the 7th one we have just mentioned, which is raw veggies, fiber, because it is antioxidant, it helps the body to be strong, develop immunity that will help us to withstand, not to develop cancer. So that is what we eat, more of fruit and vegetable. They are containing some of these. So
I think let me just chip in something also, because to some persons now, they will feel, oh, all the food I'm eating it now, but I'm eating carbohydrates, I'm eating protein, I'm eating fats, everything is inside this food now. You know, basically, what we also advise as individual that you should stay out for in aspect of canned foods. You see, these canned foods, they might be very sweet. You see this shawarma that we are eating. You see that, what they used to call it, that sausage that is in can, that will go and buy to prepare this shawarma. It's very sweet, but you know it's killing people.
Wow.
It's killing people. That sausage itself. You see people will put like 5, 6 sausage into one shawarma. They will not pack mayonnaise, put chicken, at the end of the day, you will eat everything, you will drink water, and then you will not sit down like this and beg.
I could imagine.
You see the individual, after everything, is not going to exercise, is not going to, some of them will even sleep on top of that food.
That's true.
So stay away from canned food. Carbonated drinks. Everybody is guilty of this.
Yeah.
If I go into these offices now, I will see 1 or 2 carbonated drinks.
In my office right now.
Some people cannot do without Coke a day. Some people cannot do without drinking malts. Those are carbonated drinks. And those things, if you check it properly and check their contents and browse about what that content actually means, you will see that is a risk factor to cancer. So stay away from carbonated foods, carbonated drink. Eat more of fresh fruits and vegetables. You can prepare your fruits, buy them, make them in juicy form, drink them, or make them in form of a smoothie.
Sorry, you just saying that we should just stay away from carbonated drinks, but you mentioned moderation.
Yeah.
So at least there should be moderation in taking carbonated drinks.
I think she wanted to say if you must eat it.
Yes,
if you must eat it.
Exactly.
Yes, if you must eat it.
Yeah.
Please let it not be something. There are some persons that if they want to eat any meal, they have to take it with Coca-Cola. They rather take Coca-Cola morning, afternoon, evening rather than taking water. So take it in moderation.
Okay.
In as much as the body needs some of all these things, don't make it as an habit.
Habitual.
That's it.
Yeah. All right. Moving further, what are the treatments to cancer?
Okay. We have different treatment modality options for cancer treatments. We have one, which is the chemotherapy treatment. Chemotherapy in the sense that it is the use of cytotoxic drugs. Cytotoxic in the sense that it erodes the body system. When these drugs is not like ordinary antibiotics that you are taking. Yeah. It's not like ordinary paracetamol that you are taking. You know, these drugs, when it gets into your system, it breaks down, it kills both the normal cells and the cancer cells itself. So in as much as it's working to kill that cancer cells, it's also causing disruptions in the normal cell. So that is chemotherapy. And we have different types of them. It all depends on the choices that the doctor or the oncologist wants to use and the type of cancer that they want to use to treat it. Another treatment modality option is surgery. Depending on the stage where the individual cancer is, if it requires surgeries, then the surgeon will tell you, oh, we need to remove this tumor. Yeah. We need to get rid of this thing before it's metastasized, before it spreads to other organs and other parts of the body. So surgery is another treatment modality. Another treatment modality is the radiotherapy. We have the radiotherapy machine, which can be used in form of the external one and the internal one. Exactly. The internal one is used in case cancers like the breast cancer, the cervical cancer, the endometrial cancer, as well as the prostate cancer. It's like a wire is going to pass through an individual, and then the radiation is going to be passed to hit the targeted area that they want to radiate.
Wow.
The same thing goes with the external beam radiation also. Then we have a targeted therapy. Targeted therapy in the sense that, you know, it is the use of, it is like medication also, but you know that particular one you are going to hit, you know, this is where this, you have done various investigation, you've done so many diagnostic evaluation, and then they say, oh, this is where this cancer is sitting. Instead of you using chemotherapy that will affect the whole system, because all this thing comes with their own side effects, and also adverse effect as well. So by the time you use that one now, and you see the patient comes vomiting, patient is weak, patient is feeling tired, patient is going to toilets, you know, every 5 minutes. That is how these drugs can, you know, cause a lot of deterioration in the system. So the oncologist will prefer, oh, let us use targeted therapy, so that this thing will just go straight to where that tumor is, and then hit it, and then does its work without causing more severe side effects to the individual. Then also we have immunotherapy also. Immunotherapy in the sense that is the use of immune defenses to go there and fight and boost up the immune system of the individual. Use immune therapy to boost up the immune system of the individual and then fight the cancers for the individual. So we have many of them, but these are few. But
are there any natural remedies to fight cancer? Because there are some people that say that if you eat soursop, that's a fruit. Soursop helps to fight cancer. And there was one woman that did it. She is not just a woman. She's my aunt actually. Blessed memories. She actually had cervical cancer, and when she had been trying all, she was going for chemotherapy. And she used to tell us how painful it is after she comes out. And she said, okay, they advise her to be taking soursop. All of a sudden, this woman stopped going to the hospital. She said she's going to use soursop to. Before we knew it, the cancer had spread. And unfortunately, she lost her life. So I want to get it clear. Are there natural remedies to help fight cancer?
Yeah, we call them complementary / alternative medicine. That is what is being called, complementary / alternative medicine. You know, in as much that there are some things that have not been proven medically, you know, autistic research has not said, oh, let's use this, it works. But you know, psychologically, there are some persons, though I have another person also that uses this soursop leaf, though it's not for cancer, but it's for this fibroid. And the thing actually worked for her. She was eating that soursop. In fact, she will get the leaf, she was boiling the leaf, drinking it like as if it's a water. So but fortunately the thing actually helped her, and it shrinks down that fibroid to some extent before it was, you know, eventually removed via surgery. So there are some things that medicine has not specifically proven, you know, positive in the treatment, but then with reports from also, they call it feedback from patients, trials, they call it research trials. When you use something for this person and you want to get a feedback, this person say, oh, this thing actually worked for me, you might want to use it on another person also to see if this thing is actually working. So in respect of that, we have complementary / alternative medicine in the sense that some person will use garlic.
To do what?
Some person will tell you that eating garlic is good.
But does it fight cancer?
It doesn't fight cancer. But then it tends to, because you know garlic contains acidic contents. Also, it tends to fight to some extent, though not scientifically proven. You understand, but to some extent.
All right. As we wrap up the program, can you now tell our viewers, especially those who already have cancer, how they can mentally deal with it, and those who do not have it at all, what of advice do you have to tell them?
As oncology nurses, we are being trained on how to, just like what we are doing here, how to educating the public, helping them to see areas in which they need to make adjustments, what they need to do, and what they ought not to do. So, as oncology nurses, having had this training, we've come to realize that there's so many patients that used to be so much affected. Some may even go into depression.
Yeah.
So what we do is that for those that have already developed, we try to a kind of manage them. What we call holistic care. Holistic care is a care that you focus in the whole human. For example, if I'm having pain, you don't just treat the pain. You may treat the pain, just the pain, and the pain is not going.
Yes.
There may be something wrong. There may be some other thing that is causing my pain not to go. My colleague here may take paracetamol and her pain goes. But mine, without
going.
knowing that there is something in addition to that pain. So we oncology nurses, we treat the patient holistically. Psychologically, mentally, emotionally, all aspects of human. So when it comes to their emotion, we use empathy. In fact, there is oncology anthem that we have. Time will not permit us. We would have loved to share with the public. We start with that anthem in the oncology clinic. We sing to them. It's more or less like giving them hope. Because
Assurance.
Assurance, encouragement. Help them to see that it's not a death sentence. There is still hope.
Yeah.
When we use sympathy with counseling, and we improve their quality of life. So we work on their psychic, their psychology, their emotion, in all aspects, apart from the treatment. And some of this treatment, as my colleague said, it can give them serious side effects. For example, fatigue, feeling of weakness, they cannot even do anything. So in that case, there is how we let them know that this is how to manage the fatigue.
So your major advice to our viewers now?
Good. So my major advice to the public now is prevention is better than cure.
Early detection.
Early detection. Prevention has two aspects. We have primary prevention and we have secondary prevention.
Yeah.
In primary prevention, it focuses on avoidance of those things that we have mentioned. We have mentioned diet, we have mentioned smoking, tobacco, alcohol, and so many others.
Yeah.
Avoidance. Then in secondary prevention, that is when we talk about screening, like she has said. The young girls of between the ages of 9 to 13 can go for this. Vaccination is very important. Cell-based examination for females or clinical breast examination.
Even prostate testicular examination for men.
PSA, prostate-specific antigen. You go for colonoscopy. There are so many screening tests that can be done and investigation. Because if it is detected early, you find out that the outcome, the prognosis is very favorable. In fact, we have a lot of cancer survivors because it has been detected early. So we advise the public that they should try as much as they can to go on prevention. And if at all they cannot prevent it, maybe the thing has already developed, then they should come for proper diagnosis. Because some persons may be having this cancer. The symptoms may be similar to other health condition. They will be treating typhoid. Say, I'm having fever and having. You don't know that there's some cancer.
Good. And you have gastric cancer.
Go for proper diagnosis and treatment.
I know what is wrong with you.
Exactly. And when it is treated early, you find out that the outcome, the prognosis will be very favorable.
All right, viewers, thank you so much for coming on this program and enlightening our viewers on what they need to know about cancer, the myths and the misconception they have. At least I believe that they have learned something today. So viewers, that is the much we can take on this topic on the myths and misconception of cancer. I hope to see you some other time and same time on this program, Health 247. Stay tuned and always stay blessed. All right, bye-bye for now.